My name is Jen Eielson. I'm the Director of Health for the town of New Canaan. Director of Health oversees the entire health department. So we do a little bit of everything from, the grants, the budget, the normal administrative stuff. And then directors like me also go out into the field and do, septic inspections, soil testing, and just manage the day-to-day of everything. I love doing field work. So I like to get out of the office and do that. Not everybody likes that, but that to me gives the variety. So that makes it so your day isn't, boring, and I'm still interacting with the contractors, with the homeowners, with everybody. And I'm a people person. I like to interact with people. So for me, that's the most important, rather than being squirreled away in my office, just me and the computer. I like to be with the public. After I graduated and got my degree in public health, I actually started out at the city of Waterbury as a sanitarian. Now, at that time, I still didn't exactly know what a sanitarian did, so it was kind of eye-opening to be doing housing inspections in Waterbury, and I didn't know you can call your health department when you have no heat. That just never registered to me that you could. So we did everything from no heat complaints, bed bugs, roaches, etc., to inspecting restaurants and all the normal activities. So I went from being a sanitarian in Waterbury, hopped around to different other places where I accumulated more certifications and my registered sanitarian license, and that brought me to New Canaan 10 years ago. So when I came to New Canaan as the chief sanitarian, I finished up my master's degree at that time, my master's of public health degree. And at that time, I then transitioned to being the director of health, but I still maintain all my licenses and certifications because I still do the restaurant inspections, septic, salon, pools, building permits, all that jazz on top of the administrative stuff. So it wasn't exactly a direct path, but that's, I think, the most fruitful path for a health director, because then you see every step of the way and you know what your sanitarians are talking about when they have an issue, and you could fully support them. So it didn't just jump from degree to job. I actually had to work my way up over a course of 15 years. Well, we do also a variety of, complaints, which, could be hoarding complaints. It can be anything, elevated blood lead level in children. So I do all the case management in New Canaan for that. So if your child, that's required by law, goes to the pediatrician and gets tested for lead and it's an elevated blood lead level, there are a series of steps that occur that range from just giving you education on how to prevent, elevated blood lead levels in your children, to inspecting, to approving abatement plans, and that's one aspect that's, huge for, the health, because lead is a long-term issue in children that can develop, have development issues. So, and then we also do a ton of community health programming of everything from flu clinics to COVID clinics, to every childhood immunization we do. We also provide blood sugar screenings. We do, every Friday we do a coffee talk with the health department, any topic from hydration to over-the-counter medications. This week we're talking about longevity in seniors and how social isolation plays a role in that. We do Lyme disease prevention. Then we also do public pool inspections. We license and inspect all the salons in town. We also do opioid trainings and Narcan. And we're also on many task force like suicide prevention. Another mandate that we have, we provide QPR training, which is question, persuade, refer, which is suicide prevention. So we also do that. So I think, the public in general doesn't realize we literally are a jack of all trades. So we do everything from community health to actually, providing some sort of health care with immunizations to, enforcement and prevention of the environmental, aspects of things. I'm Jen Eielson, New Canaan Director of Health. Prevent, promote, protect. This is Region 1 Public Health.